Well, good afternoon, everyone. Thank you for coming. I appreciate you being here. And this is on caregiving, and this is my company, Angie's Pace, Patient Advocates Committed to Excellence. Okay, and here I am right here. This is me. All right, I am, of course, a speaker. I'm an author. I have written 4 books. One is coming out in November. It's called 911 Caregiver Down, Who's Up Next? We're going to be talking about that. I've also written What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. That's out currently. And then in December, we're going to be having a book. It's entitled Speed Dating at the Doctor's Office. And that's because you go there so fast. And then, of course, I have my Patient Blueprint Journal, which is excellent for you as a patient, as a caregiver. Excellent, excellent. If I say so myself, I have worked, this is my background, clinical background, non-clinical background for 25 years. I worked in physician offices, 100-bed hospitals, and I did, my last one was 12,000-bed medical center. So currently I'm a professional healthcare advocate and a caregiver strategist. And what do? I create the desire for you to become a powerful patient. I help you navigate through the sea of red tape. And if you've ever been in a hospital yourself, or even if you've ever taken anyone, you know there's a lot of tape. There's a lot of papers. There's a lot of, did you turn this in? So I help you navigate through that. And so in Angie's Pace, we have some building blocks in order to have you become a powerful patient. I call them the 5 E's. And so we educate you, enable you, equip you, encourage you, and empower you. And those are my 5 E's. That's our objective. The next thing is to put you into being a powerful patient. Those are the 5 P's. Positive, passionate, prepared, persistent, on purpose. When you go to the doctor, I don't care. You need to be positive. Okay, no, if you know what's wrong or not. Because however you go, that's what you're going to draw to yourself. Okay, and there's a lot of energy going on in the doctor just in the lobby, right? So we want to bring some positiveness. Be passionate. This is your health. This is your body. Be passionate about what concerns you and be prepared. Please do not go to the doctor's office with your blood pressure medicine only in your mind. You didn't bring the bottle. It's a yellow pill with a squiggly. It's a green pill with a diamond on it. If you saw actually the catalog of pills, you would know there's a lot of green, blue, yellow, and they all have squiggly lines on it. So that's not going to work, okay? We need you to be prepared. Bring your medication. If you just had a test, bring your last test result, especially if the doctor you're seeing is for the first time, that's your specialist. So bring everything you can, being prepared. And then be persistent. If you take a test, listen, you have the right and also the responsibility to get the results. They didn't call me. That does not mean there's nothing wrong, okay? No news, it does not mean it's good news. So make sure you are persistent. Be on purpose. Stay focused. When you go to the doctor's office and you're going for a certain thing, make sure you handle that. Otherwise, you will be having a conversation at the elevator. What happens? I meant to ask the doctor. I didn't get the note. And so you're talking to the elevator and you know you're not going back in there, right? Because the elevator's not answering you, and chances are nobody over there's going to answer you as well. So you missed that. You paid for parking, you paid your copay, you're going to buy the prescription, and you paid a monthly fee, and you're talking to the elevator. That's not powerful. Okay, so the next thing is, these are 3 questions for us to get started with. Are you a doctor's patient or powerful patient? What is why power, and have you given your doctor an annual review? Well, a doctor's patient goes to the doctor, here's what's going on, ask no questions, and when they leave, they can't answer none either to their family and friends because they don't know. They were just there. But a powerful patient doesn't just ask questions, but they ask the right questions. Which means that the right questions are, if you don't understand, you ask for clarity. You should not leave not knowing if what they've talked about is your symptoms or your diagnosis, because they're not the same. You also should not leave there with a prescription not knowing if it's a life medicine, if there's a time you stop it, if there's something you look for it to start doing or stop doing, and if you have a reaction, where do you go? To the doctor or to the ER? These are important things. A powerful patient, they know all of that information. All right, Y-POWER is the acronym I created. Your providers owe you wisdom, ethics, and respect. Now, your provider is not just your doctor. It's the person that does your scans and imaging. It's the person that draws your blood. It's even membership services. Everybody who gives you any service is your provider, and they owe you wisdom, their expertise. That's why you called them. That's why you made the appointment. And ethics, they should be ethical in the way that they handle you, and definitely, without question, you should get respect. Just because you don't know about medicine doesn't mean that you're not qualified to ask the question. Because you're more than qualified because you went to where the source was. And lastly, have you given your doctor an annual review? If you've worked anywhere, you know the annual review is a must. What does it do? The annual review is twofold. It talks about what you've done all year, and if you hit your objectives and goals, and also it says what is your employer, director, manager looking for next year, okay? Obtainable goals or things that need to be changed in that manner. So you want to make sure that you definitely give your doctor a review. And let me tell you some things you should be looking for. If you go into the office and there's always 25 or 30 people looking like, I wish we could get out of here, you need to think about that. Is it that day? Because Monday's okay. But every Monday and every time you go in there, when you go to call or make an appointment, ask for a referral, how does the office staff treat you? It should be with wisdom, ethics, and respect, right?
Right.
Okay, next, when you need a referral, why are you begging? Why are you pleading? Why are you giving a case like this is Perry Mason or something? Come on, this is your right, okay? Exercise your rights. And so therefore, if you ask for a referral and you're not getting it, and you don't say anything about it, then that means that you're saying my health is not as important to me. Because you can see it's not that important to them, correct? The next thing is when your doctor is on vacation, something could happen to you. Is there vacation coverage? Of course there is. But what kind of coverage? Is it the coverage like, oh, call my answering service and I'll call you from Tahiti? That's not coverage. Okay, you know, they're supposed to be a living, breathing being that actually takes care of the patient. So these are things that are very important. And let me tell you, you might not think it's a big deal now, but when you have a chronic illness or catastrophic illness, it is a big deal what your PCP does on the regular. If you can't get a call back for the flu or for birth control pills, you're not going to get a call back for any other kind of screening. That same office worker has the same mentality of, well, she'll call back or he'll call back. And so you need to think about this, because annually you have the ability to get another physician, especially a PCP. And don't be afraid to change doctors. If there was only supposed to be one doctor, why are people still studying medicine? I rest my case. Okay. And so here's my book about OLLI, and these are the things we're going to talk about in the first half, because I want to talk to you about being a powerful patient. These are the 7 things we're going to go over, and so let's just get right to it. Is your PCP your friend or foe? It's supposed to be friend, but does your PCP come in like someone is chasing him? Have you ever had a doctor come in and the wind comes in with them? I mean, if there was a second door, they'd be going like, hello, and they keep going, but they only have one door. But if they could, they would, okay? The next one, Do you become anxious during the appointment in the first 5 minutes? So what are you here for today? You feel that rush, like, spit it out and say it. And so you are already feeling some kind of way physically, right? Who knows if you slept in the last couple of days. It might take you a few seconds to say, you know, well, this is what usually people say, I'm not feeling myself like myself. That's not the answer. What you need to do is immediately, many people say, I'm nauseous, I've been like this for 3 days. I haven't slept in 4 days, or whatever. And to help you to be able to stay on task, write it down. Because I don't care what you're thinking about. Once that white coat comes in, with all that writing on there, you start reading that again, you're involved in something that has nothing to do with you. What's on that coat, really, it's too late to figure if that's the right doctor, because you already made the appointment. So let's just get to the bottom of what we need, okay? The next thing is, have you ever wished you just stayed home because it's not that bad? Come on, when you get in there and the doctor is pressing and makes you feel like you're not wanted, you're just like, you know what, doctor, I thought it, you might have 3 complaints, but you're going to at least get 1, because otherwise, why did you make the appointment? You have to make it legitimate, so you just say that. Then you go home talking about how bad you feel, and your relative says, didn't you just go to the doctor? And then you get mad, oh, why are you mad at them? Okay, but it happens, come on. Does your doctor greet you and look you in the eye while you explain the symptoms? That is called active listening, okay? Because they want to know how you feel. They're watching your body movements. Are you leaning forward? Or it's like not just what you're saying, it's your physical presence. That's what doctors do. They're supposed to take in the whole scope of what's going on with you as their patient. Are you comfortable knowing that your doctor is the partner on your healthcare journey? PCP should be physician, collaboration, and partnership, and you are not a silent partner. Okay, you are a voting, speaking, get with me partner. Okay, remember that. The next thing is, would you gladly recommend your doctor to anyone who needed their services? That's so sad if you can't say yes. If you can't say yes to this, membership services should be your next call, because you get a new doctor. All right, now this is my chapter 2. I love this chapter. I'm not sick, I'm a man. It's the Manhood Creed, and all men subscribe to it. Okay? Men just won't admit what they don't know. If they are in pain, because it doesn't hurt that bad, because I'm a man. See, my pain and your pain is different. A man's pain, men hold it in. And so if you have to go to the doctor as a woman, it's okay, because you're supposed to let pain out. Men won't admit when they are afraid. And believe me, if something is hurting you or you're feeling dizzy, you feel like, what is going on with me? But with the Manhood Creed, stay strong. And they don't want to admit to any weaknesses. They don't want to take off, time off, be off, because as most men, not all, are raised, they are raised that they are protectors, providers, and so therefore they are at the top of the food chain, so nothing can overtake them. And that is why, ladies and gentlemen, men die much sooner than women. And they die by the thousands for the simple reason that they won't go and get information. It's a fact that women will go for several things. Most men go to the doctor once every 5 years. That's inexcusable. So if it's your brother, your father, your husband, your cousin, your neighbor, let them know the doctor, that insurance they're paying for, it's available for them to have a visit. Encourage them to go. The how and why of mass diagnosing and misdiagnosis. All right, you might not think so, but it happens to you all the time. All the time. And you just are you don't really know what happened. You go to the doctor, and it's like several patients, and you begin to give your symptoms, and here goes the mass diagnosis. All my patients came in with that this morning. All women your age. All women your weight. This is going on. Where did you say you worked? That has nothing to do with what I'm presenting right now. And first of all, my name is not all, right? My name is Angela, so therefore, we need to be talking about Angela, not all. Actually, that's a HIPAA violation. We shouldn't even know what happened 2 or 3 patients ago, right? Okay. Do you have clarity about your exact diagnosis? I say no. Most people and caregivers, when you ask them what the diagnosis is, they give you symptoms. That is not a diagnosis. That is not it. I have to go to the bathroom a lot. That's not a diagnosis, right? I have a bladder infection. That is a diagnosis, okay? I'm feeling dizzy. That's not a diagnosis. But I have vertigo. That is. So insist, not just what you said is wrong, not just what they said may happen to you. What is it called? Because you may be traveling somewhere and have to give that information out. And it could be vital depending on where you are and what's going on with you in the world. Okay, what is your plan of care? Is it a secret from you? Yes. And many times it's definitely a secret. Because you go home or people are saying, well, what are they going to do? Well, they'll call me. Call you what? What are they going to call you? No, they're not going to call you. Because you're gone. So, you know, they're going to fill out the encounter form. Next. That's how it goes. You leave, you relinquish any right to get any information because the appointment is over. However, if you wanted to pay your copay again, parking, any other thing, you can get some more information, but you'll have to pay again for it. All right, treatment options. Do you have any? Absolutely. No matter what is going on with you, yes, they could write you a script or they could give you something, but you have the right to say, would diet help this? Could I take a vitamin, or instead of that medication, it makes me feel a certain kind of, do you have something else that would do the same thing? Please, please do not be afraid to ask about your health. Don't let it be a secret what's going to go on with you from day to day, because you have to live with it. Absolutely. Okay, here's Y Power. What is it? Where do I get it? How do I use it? All right. What is it? We talked about what it is. Your provider for you, wisdom, ethics, and respect. Where do I get it? Well, you actually get it by practicing, right? Asking questions. Going to the doctor and not just allowing the doctor every 23 seconds to interrupt you, because that's what they do. They bring you back to task. And actually, it's now every 11 seconds. So what you should be doing is, that's why I said being prepared, you write it down. And so you say to your doctor, can you please just let me tell you what is going on with me? And that way, they will have complete information to give you a real diagnosis. All right, and how do you use, we talk how you have the right to receive excellent healthcare services. It's your responsibility to require them. Absolutely. You are paying for health insurance, or no matter how it's being paid, no matter what it is, you absolutely, when you go there, you are the most important person in the room. Remember that. If you weren't a patient, they wouldn't be working. You don't need a doctor if nobody's sick. You don't need any nurse if nobody's sick. You don't need any of these people. So make sure you require, it's your right, make sure you require them to treat you with excellence. It's going to be your responsibility. It's going to be on you. I said the other time, you know, that whole Marcus Welby and Dr. Gannon, who used to get against the chief of staff, and you know, those people, they're gone. Just like the TV show, it's over. If you want to get great health care, it's not that it's not available to you, but you must not just expect it, you must insist on it. So that's why a powerful patient is persistent. All right, I call this Can You Hear Me Now? This is another about the review. You don't want to ask your doctor anything? Google them. It's on there. You'll find out about if they have malpractice suits from the other place they came from. You'll find out why their patient room is always busy, because other people are complaining about it as well. You'll also be able to talk about your doctor's bedside manner, that rushing in, and the staff. You know, when you call, and you always get them put on hold for 15 minutes or more. You have to keep calling back. As soon as you say who you are, right? All right. And then what about vacation care? We talked about that. And referrals. This is so tremendously important. If you have an acute diagnosis and then you need to see a specialist in order that it will not become chronic, or if it's chronic you don't want to go any further, I'm telling you what is true. All this 2 or 3 weeks, it's not. This is the click world. They click into the insurance people and they click back. The only thing that takes them is 2 to 5 days, I guess, mailing the hard copy to you. But the authorization is in place. And actually, a great doctor's office gets the authorization and makes the appointment for you so that you can just go there. That's what a great doctor's office does. But a good doctor's office will get that authorization quickly because it doesn't take all that. So don't accept it at all. All right, this is my favorite part. I talk about the hospitals. You think I never worked in one, but this is true. The hospital discharge is the most unanswered, unbalanced, unforeseen, unfriendly, and unorganized of the entire medical thing. For sure, unanswered. How many people check out of the hospital and have no idea what's going on afterward? They don't know when their next appointment is. Somebody will call you. They have no idea if they needed some kind of special equipment. If they do, they don't know when it's going to be delivered because somebody's going to call them. They don't know if they have to go to a referral because if they've seen multiple doctors at the bedside, you need a return visit. But what? Somebody's going to call them. There's no answers. Okay, unbalanced. This is the part where someone's been in the hospital more than a few days, and so you, the caregiver, go and, almost pack up a house and take it to the car, and you're waiting for them, but they're waiting for somebody to roll them down. Amazing. It's amazing how hard it is to get on the elevator and go a few floors to get in your car. But it definitely happens. Okay, unforeseen. You call back to the doctor's office. Oh, the caseworker didn't give that to you? Yeah. Unfriendly. Yes, because are they coming down yet? Well, we're waiting for somebody to bring them down. I'll bring them down. Oh, just give me the wheelchair. And unorganized. Definitely unorganized because here it is. Doctor, when am I leaving the hospital? I'll let you know in a few days. 30 minutes later, the nurse comes in and says, what? Tomorrow you're being discharged. What happened? How is it organized like that? Because depending on your record, once they look at where you are now, how long you've been in, there is a scale that the insurance company has that says they're out. It's time to discharge. But here's good news. If you have Medicare, whether it's Advantage Medicare, any Medicare, and you feel, or if you're a caregiver of someone, you feel that they are not ready to go home, you simply ask for the Medicare person that's on site and you get another 72 hours to be re-evaluated. What good does it do when you know you don't feel good or the person that you love doesn't feel well? You go home and in less than 24 hours you're back in the ER readmitted. This is how people end up with sepsis, staph infections, a lot of things because it's too much transporting in and out. And the worst thing that Medicare does not like is readmit, especially within a 2 to 3 day period. They're never happy with that. All right, here it is. Do you want to get out alive? What could stop you? Not knowing your diagnosis, that could stop you from getting out alive. Not asking the right questions. Listen, there's always a hierarchy in the hospital, so this is how sometimes people get confused. They're used to their PCP. Who's not coming to the hospital to visit you? The person that takes care of you there is called a hospitalist. They operate like a PCP. But if there's something going on, there's a surgeon, then the surgeon is now the person in charge. If your diagnosis is something like something to do with orthopedic, that person is in charge. If you have orthopedics and then you also have oncology, that person is in charge. If you have oncology, now you need neurology. That's at the top of the scale right there. So everybody, and this is the answer you get, the doctor said. You have multiple doctors. What is the doctor's name and what is his service or her service, okay? And actively participate in your choice of treatments because you're the one that's going to be getting the treatment. So you want to do something that you're going to engage in. But this is something so important. Medical errors kill over 440,000 people right here in America every single year. And medical errors is not just you got the wrong medicine, and not just you had the wrong surgery or something got left in there, which that's a medical error. A medical error is also that you had the wrong procedure. You could be ordering a scan and they ordered it with contrast, but you're allergic to iodine. There's going to be a situation that happens with that. Now they are asking surgeons to do site signature, where the surgeon actually comes and signs his or her name wherever the surgery should be. Why is that? If they invert that scan or x-ray, the left is the right is the left, but that signature validates. What if your doctor's on their way and they get sick? They knew it, but the new surgeon is just looking at this. But that signature dictates what's going to go on the leg, wherever it is, there's a signature. If there's an amputation, they paint that whole part purple. It's a stain that can't wash off. All of these things have been implemented because there's so many, not just large medical errors happening, but small ones. Medication. Most hospitals, large hospitals, have the EMR, emergency medical record, but what also happens? People don't look at it. People are making errors. They look, they glance, and then there's another patient, Mary Johnson and Mary Johnson. Mary Johnson and Mary, they're both Marys. You could get the wrong Mary's medication. So when somebody passes you something, there is a patient identifier. They should ask you 3 questions. Your name, your date of birth. They should scan your wristband. If none of these things occur, don't take the medicine because there's an issue there. Remember, most of these things that are happening, we voluntarily participate. That's why we can't get out alive, okay? And never go in the hospital alone. They need to know that somebody's walking in their room all the time. Something's happening all the time, okay? That will make them not just respect you and take care of you, but they're going to really participate what that person is seeing about you as well, okay? And this is a patient blueprint plan. October is Medical Records Month. And so listen, when you go to the doctor, not just the one you usually go to, you have to go to a new doctor. Even though your record's there, they ask you the same things. Your last surgery, your last test, your blood type, or the person you're caring for, their blood type. What in the last 30 days, what medications were discontinued. You would be surprised that the people are primary caregivers and don't know. They have no idea. And depending on the physical state of the patient, if they're taking something that takes them in and out, you can't really rely on what they're saying as well, right? So the doctor is asking because there's sometimes mistakes in the record, so we want to make sure of that. So here's me, the caregiver strategist. I say the 5 C's. Communication gives clarity, clarity leads to confidence, confidence shows compassion, compassion manifests collaboration, and collaboration engages others. I want to inspire you to get excellent health care and then take care of yourself as well. You cannot pour from an empty pitcher. You need to go to the doctor. If you're a caregiver, you should have appointments. People, and I can understand, you think you're going to the doctor because you're taking somebody to the doctor. You're there so often. But you must go and get your own physical. You must go back and have your medications checked. Make sure that the medicine you're taking is actually doing the job that it was set to do. Maybe different things have happened. It's a fact. In 5 years of being a primary caregiver, you go from great health to mediocre health, to fair health, to poor health. So now you're in poor health, taking care of someone else who's in poor health, or fair health. So imagine those tasks you did at the beginning of the 5 years, they are so much harder when you are fighting yourself to try to just do basics. So that's why I want to encourage you to take care of yourself as well. I say this on my show all the time. Let me just say this again. Thank you. Those are 2 words that every caregiver needs to hear. You are relentless. You're irreplaceable. You are so important to the welfare of those that you take care of. And I know that you're always being selfless, but in that being selfless and in that being everything everybody needs, you need to take care of yourself. It is not being selfish. It is being responsible. Because that person can't make it without your great care. So make sure that you take care of yourself. It's always an honor for me to say that. Are you prepared to receive help, caregivers? If somebody came and said, well, what can I do for you? You know you need help because you're swamped. But what do you say? I have to get it ready and then you can come help me. But that might be the only time they can come until the next week. And so that's why we want to establish the caregiver team. Now, who is that? I told you the family, like family. Who's eating all the macaroni and cheese at your house? Get that list. That's your A list. Because macaroni and cheese is not cheap. So people that are eating up all that macaroni and cheese during Thanksgiving and all those holidays and all that pie and cake, and then listen, did you make a pie for me? That's the A list, okay? Those are the people on your A list. And then the neighbors, you know those kids who think they're really your kids, especially when it's time to feed them? A-list. And then your church people, they always want to know what's going on. Come on, A-list. And then social clubs, right? You pledge allegiance, the A-list. And then your civic groups, if you've held offices. The problem is people don't want to put anybody on the A-list. But you have to. The family care team, how you have to create one. Start off with a 3-month calendar. Get a quarter together. Okay? Prioritize what must be done. Your appointments as well as the person you're giving care to. Write down any conflicting appointments that you have with your loved one. Those are the first orders of business, right? If they're going in the morning and you're going 4 hours later, chances are something's going to happen. So don't double book. If you are double booked, get those people eating the macaroni. Somebody can help you. Write down all the tasks and then the amount of time. Here we go. It's the issue. It might take you 30 minutes because you do it all the time. Give them 90 minutes. If they come up faster, we have something else for them to do, right? Don't be afraid. There's always more work. Write down the holidays and vacation that you want or need or may have to leave town. Don't go around Easter, because Easter fluctuates between March and April. They might think Easter's coming in April, but it actually came in March, then you don't get any time off. The next thing is errands, prescriptions, food pickups. Those are things that people can be called on in a few moments' notice. Because if they're driving that way and you let them know it's going to be ready when you get off work, could you just drop it by? These are sometimes things we don't think about because it's just, we think it's so mundane, it's so small. But if you can't leave that person, you have to pack them up, that's a different kind of situation. So this is the most important one. Don't decide what people will or won't do to help. You are not all up in here, okay? Give them an opportunity to show you that they want to help because they've called and offered their help. So let's do that. Here we go, multiple adults. How does this happen? Very easily. You could be married to someone that needs care. And then their dad gets sick and there's no more children there. And then your mom gets sick. Or both of your parents, your mom's taking care of your dad and you're trying to help her. So now you've got the husband and your dad and or father-in-law. Or if you have a grandchild. So now your daughter or son is working and so you're trying to help there. And so it's very simple because a lot of people are just like, oh my gosh, you're just wearing yourself out. No, you're being worn out. You didn't sign up for it, but you need help. This is why you need the team. Everybody needs a team. Everybody can't do everything, but everybody can do something. And when you don't allow people to help you, you're really saying that I don't care how it goes in here. It's just survival of the fittest. And I know you're not feeling that, but your actions are actually displaying that. Caregiving at a distance. I'm telling you, that's a different thing. Look, Southwest had a bunch of tickets. I hope you bought some. If you're doing that caregiving at a distance, because you need to have them ready. But there's other ways you can do it if you have to fly or drive for hours and hours to get done. Family, friend care, phone call, and email care. All right, so now, when you have that A list, you have someone that can maybe help. That's if the person that you're caring for at a distance doesn't have anything seriously wrong. But you just want somebody to check on them. The time to get checks and balances is not when somebody's down. You've been living 500 miles or more away for years. So this is not new. But you've not lived that far away and needed help. So that's why you need to come, when you come here, go to the doctor, meet their neighbors, meet the folks that they're talking to all the time. If you are here, Miss Jones, find out who Miss Jones is. Where does she live? Who is she? And give her your number. So that if something is happening, everybody can be in the loop. This is how you help at a distance. There's hired caregivers, caregiver.com, and verifiable care. So those are agencies that you can actually pay. You don't have to actually depend on family. Or it might be there's a family person, and because you know the do's and don'ts of an agency, if that person goes down, you can at least hire someone until you can come. Because you're at a distance, you have to always have plan B and C when we're talking about caregiving. We have to always be prepared. Respite care. Now your insurance company and community resources. If you are a caregiver, there is respite care. The government mandates that 1 week every 6 months you're entitled to respite care. Even if they're bedridden, they can be taken by ambulance and they'll be taken to a facility where they can be cared for that week. But no one's going to tell you this. These are things your insurance company is willing to pay for. But they used to send us all those books in that pack that we didn't open. Now those things are online and we don't go in the portal, but it's still there. Go in there and look and see before you need it, before it has to happen. Physician contact. Make sure that you're on record as a decision maker, because if you're far away, you should be able to say something until you get there or until you have someone else there. You should not have to prove who you are at that time because there's something emergent going on. Advance directive. Now this is a touchy thing, but here it goes. Advance directive gives a lot of power. If you don't want to give the advance directive to your doctor and hospital, you want your wife or spouse to keep it, that's fine. If you don't have one, you need to find someone you can trust that is actually going to bring it. So when something happens, please don't keep your advance directive a secret from your older children or anything like that with your stepchildren. Even if you don't tell everything that's there, let them know there's something in play. The reason things go really out of whack at a hospital is because nobody knew except maybe one other person. And then when they should be pulling together for you and making a plan for you, they're making other plans. So we want to make sure that we keep this. Power of attorney, legal documents. There's a living will, and then there's the will, and then you have there's several things you can put into place. As the caregiver, if you're not blood related, you need to have sometimes some kind of documentation, because when the blood relatives come, then you're out. So if the person you're caring for, whatever, these are things, I know it's so hard to talk about because who really wants to talk about the day you're not going to be here anymore, but it's so important. Okay, it's important to know what's going on and that things are on file. Physical, mental, and emotional sides of caregiving. Do not isolate yourself. I know you feel like it's just too much. It's too much to get up and go to church. It's too much to go outside. Then allow people to come in. You can have like a little coffee day. You buy all those different flavored creamers and all that stuff, and it'll be fine. I said, whatever holiday you subscribe to, instead of trying to do your whole house inside and out, do one room, be happy about it, okay? If other people want other rooms, they're free to come and do it, and they're free to clean it when it's over. But you just be happy with what's going on, and don't feel guilty or beat yourself up because when everybody came before, it's always like this. I always cook this. It's not an always kind of life now. We are adjusting and making adjustments. And as we make adjustments, when we do it in our mind, then our body makes the adjustments with us for the good. Are you avoiding contacting your family? And when is the last time you went for a physical yourself? I put that up over and over because it's so important, caregivers, that you take care of yourself. I know you feel like you're okay, but I always call her Princess Leia from Star Wars. Now, until she died, I didn't know she was Debbie Reynolds' daughter. I just didn't. But what happened, her death was just like sudden, right? On that airplane. Was it 2-3 days later? Debbie Reynolds dies before Princess Leia's funeral. It's called The Body Remembers. When she got that shocking news, right? Her body just revved up like this. But once you relax, then the body remembers there was a heart attack about to happen or a stroke or whatever. And once you relax, the body physiologically takes over. So when something is going on strenuous with you and you think like, oh, I'll be okay, go to your doctor. It's okay to go to the doctor and see about yourself. Especially if something happened that you didn't expect. They were sick, they just got out, but there's gonna be another surgery. Keep check of yourself because it happens just that fast. And so this whole thing is about letting you know if you're the lifeline and you go down, then everybody's going down with you, and that's not what we want to happen. Caregiving of the exes. Isn't this entertaining? Okay, here we go. You're caregiving for him or her because nobody's taking you off the insurance yet. The paperwork is not changed and somebody called you because you're the emergency contact. What was his name again? Okay, all right, the in-laws. Okay, your spouse is deceased, but you still have a relationship with his parents. So, you know, you might be doing some caregiving for them. The outlaws, because you don't want to have nothing to do with him or them, right? But some kind of way they still have your number. And somebody called you. In all of these instances, you need to have information as who's the decision maker. The advance directives, the power of attorney. If you're going to participate with the exes, it's very important to legally know where you stand and also where you do not stand, okay? It saves a lot of problems. And how many people felt the earthquake today? Okay, good old California, you never let me down. I don't have to tell anybody in California about having an emergency bag because there's always an emergency, right? If you live here, there is an emergency. If it's a fire, right? If it's an earthquake, flood, well, something is happening all the time. Make sure that you are prepared and stay ready. That's number one. And follow and pack all the items on the emergency checklist that I will give you. All right? Because every emergency is an emergency. You might not be snowed in, but there are people being snowed in. You might not have flooding, tornadoes, or hurricanes, but there's a lot of people that witnessed that in the last few years. And so, I did say this. If you have someone that has a special medication that has to stay cold, and you put the cold pack in the freezer, you don't take those for picnic lunches. That stays in the freezer. Buy another set. Because when the emergency hit and you have to leave and take that medicine, that's when it hit. Right? It doesn't get cold that fast. And so all you need to do is be moving and packing because sometimes time is of the essence. So, let's see. And this is me, Angie's Pace. You can find me on Facebook, Say It's Sunday, 5:30. I do a daily show at 9:05 because people are always 5 minutes late, right? Monday through Friday. And then this is my website. Okay, Cassandra's standing there. Are we having a moment? I'm just about done.
Oh, you are?
Mm-hmm.
Oh, okay.
Okay. All right, so this is what's coming.
Can you go back to that? So we gotta take our picture.
Oh, okay.
We're slow on our smartphone.
No, right, we're not so young. Oh, my God, come on. This is a place where you can find me. And this is my website that talks about me and how the company got started. I'm not sure if I told you that part, but actually I was a caregiver. So I know about the caregiving. Not only did I work, I was a caregiver for my husband for almost 2 years. So I know a lot about the emotional stress and being physically worn out because I actually worked. He was in the hospital, I worked in the hospital. And when everything was done, this is what I tell you about taking care of yourself. I was so anemic, I had to take a specialized iron pill for 2 years, day and night. I had been in the sun for 1.5 years. I had to have a specialized vitamin D for almost 9 months. So I know what I'm talking about when I say you're just going, because you can.
Right.
But when it was over, I found myself, even before, on La Brea in Washington, sleep on that hill. And somebody blew, and I was like, I had to come back, like, what was I doing in the car? I was gone. So I'm telling you that it is so important that you get rest, that you get a team, that you allow someone to help you. Because I could have hurt somebody in that car or hurt myself. And so I had to really take inventory of really what good was I going to be doing if I was laid up in a hospital and he was in a facility. How was that going to work for me? That didn't serve either of us. And I know that you feel like if I'm not there, he or she is not getting the best. But if you're in the hospital, they aren't getting the best either, right? So isn't it best that they get maybe a little less than best for a few weeks while you rest, than you being there for months or longer? So that's one thing I want to definitely
Excuse me.
tell you about. Yes, ma'am.
Say Sunday. Is it the radio show?
Every week. Say It's Sunday. It's every Sunday.
Every Sunday.
Monday through Friday.
Monday through Friday, I do a daily show at 9 o'clock in the morning.
Which channel?
No, on Facebook.
Oh, Facebook.
It's on Facebook.
Oh.
So if you just look Facebook, you look me for Angie's Pace, then I have my own page, and so it'll connect you to the show.
Oh.
So on the Facebook, if I'm searching for you, you don't look for Say It's Sunday, or you look for Angie's
You look for
Pace?
Angie's Pace.
That's what she's asking.
Yeah, okay. Look for Angie's Pace.
Okay.
Everything Angie's Pace or Angela McGowan. I'm on there.
Thank you.
And then this is my website, and it has everything on there as well. If you need some more information from that. Okay, so this is just another way to get me. It's the link tree, and it has like different forms or different things that you might need. I have that already there for you. So in November, December, January, I think I took the January's down, but in November, it is Family Caregivers Appreciation Month, okay? You need to make sure I get your email so I can send you a certificate. You are so special, okay? And if you know other caregivers, send me their name and email, and I will send it to them as well. So I sign it here. If you want your own, when I send it to you, you can print it and put your name there, right? And then you put the caregiver's name there. If you're giving it to someone else. If you're not giving it to someone else, I'll be sending it directly to you. All right, so I want to acknowledge you. And so this is my book that's coming out in November. 911, Caregiver Down, Who's Up Next? That's what we were talking about today. Because we have to have a next. We must have somebody else that's next. Even if it's for the next few minutes, or the next few hours, or the next few. If you don't have a next, then you're saying that you're invincible, and that is absolutely not possible, right? This is not. And then in December, I'm going to have this one, Speed Dating at the Doctor's Office. This is going to help you stop having elevator conversations. You want to talk to the elevator about what didn't happen in the doctor's office, because it's going to take.
I've caretaken is my upstairs neighbor, who is like all by herself. She doesn't have any family at all. She has some friends, but and actually today's her birthday, and she's 90 something. I think low 90s, not high 90s. You know, and She does not have a primary care doctor. She has other doctors. She goes to a nurse practitioner for diabetes, and the nurse practitioner can't recommend. It has no primary care doctor. I know what kind of insurance she has. How do you go about choosing a doctor? She has this great big book. None of the doctors are geriatric doctors, and do you recommend somebody at that age getting a geriatric doctor?
Definitely. If in your insurance thing, you should have a geriatric doctor. If there's not one, but this is what I said last week, you'd be surprised at how many people operate without a primary care physician, which is why your care is usually inadequate. Sometimes people go in the hospital and they have specialties. Those are the people that come to the bedside. Then the patient starts going to that doctor, right? About whatever is acutely wrong. But that doctor doesn't have the primary care doctor to confer with. Nurse practitioners are usually like the middle people that are helping. But a nurse practitioner, I told you, you want to make sure they have what? Their own DEA license and their own malpractice insurance. That's who you want to see for your primary care physician. That lady needs to call, and this is anyone. You call membership services. Membership services can find in your location and the specialty of primary care physician that you need. If for some strange reason that insurance company doesn't have any access to any geriatric doctors, they are required to pay for her to see a geriatric doctor privately. That is out of network. If that group does not have one geriatric doctor at 90-something years old, she can get an out-of-network geriatric doctor, and membership services is required to pay for that, to take care of her. There are responsibilities that the insurance companies have, but of course, if you don't know them, you don't enforce them or have your rights and your responsibility. That's why it's so important that you go into the portal, that you look on, even on the back of your insurance card, it's like usually 24-hour nursing call you can do and different questions you can ask. These people are being paid to answer your questions. Please don't feel like you can't do it. You can call them and get that information, but she definitely does have the right to have one, and they are going to pay for it. But if she's 90, she has no Medicare?
She has Medicare.
Okay,
She has health insurance as well.
Medicare.gov, okay, that's all you need. www.medicare.gov, that's all you need. They will make sure she's taken care of if nobody else is up to it.
She has health insurance as well, HIPAA, and I'm not sure.
I'm not sure what that is.
I think that's an HMO and it's torrent something or other, okay? But, so she fell, that's what happened. And she went to a doctor who must have been in that network, whatever it was, who was closest to us, and he was horrible. I was taking her to the doctor. And he recommended physical therapy, and the physical therapy was horrible. I watched this old woman who is not an advocate for herself. Her personality is sort of shy. Just, wow, people just treated her like, you're going to die, so what difference does it make?
That's true. And so this is the reality, unfortunately, that is part of our healthcare industry. If you are 75 or above, they're already counting the average number of days that you're going to be here anyway, and that is how they move forward. That's why you have to speak up. If you don't speak up for yourself, you cannot expect them to speak up for you. So I always say, call the membership services and tell them what you want, who you want to see. They know above all else how to get you where you want to go. Yes, you might be on hold a couple of times, but your health care is definitely worth it, okay? Because in the doctor's office, there's your PCP. The reason you need the PCP, they are the gatekeepers of everything. They know so many things, you'd be so shocked. I think I told you, when my husband, I was running around trying to take him back and forth, but there was an ambulance service to do that for me. So I got the ambulance service to take him back and forth. I got the nurse practitioner to start coming to the house. I got all the blood drawn there so he didn't have to be uncomfortable. But this was all like automatic. But I was the person who didn't know. So, and if you can work in the hospital but don't know how the hospital runs. So I found out how it was running, okay, and I could stop running. So that's why we have to ask the right questions every time. Okay, I hope that answered your question.
Any other questions?
No, I think that's it. Did you have one?
No, I didn't know, I'm just.
Oh, you're helping him,
around.
okay.
She was, yeah,
okay.
So he doesn't have. to
Okay,
pay.
well, let me just say this in regards to when I was talking about home care. Now, when you get out of the hospital, there's something different. They give you home health care. Now, that's not going to start usually for 72 hours after you get home. Not because they're not ready, but remember, they've got to call Medicare, whoever, to verify you're eligible, right? And then in home health, everybody's independently contracted. So it's the speech therapist makes their own appointment, the physical therapist, the occupational therapist, everybody makes their own appointments. And so they get your names and they begin to call. So if you're thinking, as a caregiver, as a patient, home health is coming, they are. But 72 hours to get authorized, and then you have to set the appointments to make sure it goes with your schedule, because you might also be going to return visit appointments as well. So you have to make sure you take that in consideration. When people are talking about being taken care of for home health, sometimes they think that means that the caregiver can be out and off while home health is there. But they're there for a specific service, and the time ends. There are a few agencies that do have caregivers, but that's a separate expense. Medicare doesn't pay for that. Neither does your insurance, unless you have a disability insurance or long-term insurance that already builds that in. There are some out there that already build days in. If you go to facility care, and this is something, let me remind you of, especially if you go to the ER and something happens. If you go to the ER for whatever emergent reason, make sure you get admitted, okay? All this observation stuff, 24 hours at best. Because if you're not admitted for 3 days and go to facility care, you are paid for that. Medicare is not going to pay for it because you were not in the hospital the recommended 3 days. And that bill is enormous.
Say that again?
When you go to the hospital, let's just say something urgent happened. You know, depending on what it was, but by the time they finish, diagnosing or saying what it is, they say, you can't be alone. There's nobody there with you, okay? So you can't be alone. So you're gonna have to go to rehab facilities. You need skilled nursing, that's what you need skilled nursing. If you were in the ER, under what they call observation, which means you were not checked in. Observation is like an office visit. And that can be done to up to 3 days. If you, after observation, they say you need skilled care, but you don't need acute care, inpatient. We're going to send you to skilled nursing. If you were not admitted for 3 days, you pay the skilled nursing bill. And people find that out after.
If you were not admitted to the hospital
That's right.
for 3 days,
That's right.
what if they say you don't need?
If they say you don't need to be admitted, why are they sending you to skilled care?
Yeah.
But it happens. It happens like that because hospitals are always looking at the bottom line, right? And depending on your age, the bottom line is you need to go to skilled nursing, especially if you live alone or they feel you may fall or something. If you have something like vertigo and they feel like you can't be home, well, you don't need to be necessarily inpatient for vertigo, but you can't be at home with that because you're alone. That's why it's important to have that PCP, someone who's going to be calling the hospitalist and saying something about you. Someone that your family can go back to and say, hey, my mom's in there, but she's just in observation. What is going on? So you have to, and now don't think you're admitted because you got the wristband. You've just been identified. Okay, the wristband identifies you. It doesn't say you're admitted.
And how long can they keep you for observation?
They can keep you as long as they want to keep you. But I'm saying that usually within 3 days, they make a decision that you go out, that you're admitted, or you go to skilled care. If you are wearing wristbands and think you are admitted, you are not. You are in a holding pattern.
Okay, I have one sister, she,
Talk in the microphone so no.
oh, her husband has got Alzheimer's.
A little closer. Okay.
Her husband has
Alzheimer's, okay.
And so he jumped on her.
Come on.
So meantime, 911 was called in, they took him out, and now he's in a facility now in out in East LA or whatever. But meantime, she got to find a place to put him in.
Okay.
But she's through Kaiser. But the thing is, she don't know, they looking for a place to try to help her, but meantime, they're not getting back to her or anything. Now, he's in this facility though, and does she have to pay that while he's in?
Well, that's an emergent placement. Now, that's something different. They put him straight into a facility.
Right.
That's different than you went to the hospital and then you went to the facility. That's a different kind of placement. But Kaiser, she should get a case manager to work with her at Kaiser. She should call and ask for the case manager. If the case manager is not calling back, then that case manager has a manager and a director. Find out who they are. If you have to go through membership services to find out who they are. Okay, because Kaiser is being paid, and so services need to be rendered for that. Definitely. Okay.
Yeah, Cassandra. Oh, she's not there.
Yeah.
Okay, you said something about, what is more important to get, a will or a living trust or whatever?
Well, the will is usually when you're deceased, and the living trust can be activated, like who can spend your money, who doesn't spend your money. There's specific things that you can put in the living trust. If someone can speak over you as far as being your, in California, see, it's the living trust and the power of attorney, and then they have the advanced medical director. California has so many choices. You need to get all of them. Because but what they do have, if you go to a lawyer, there is a combination one that has actually who speaks to the advanced director part and who is in charge of the finances and decision making. But I'm just saying, in California, you can come in, 3 people can have one of those papers, each one of them, because that's how California has decided.
Okay, like my husband is through the VA. So meantime, I've already been placed over the finances of the home. So will I need to still get a?
That's why he is still alive. If someone comes up with a will after anything happens to your husband, then they are the new sheriff.
Okay, well, all his family is
Okay, well,
deceased.
Okay, so it looks like there's no sheriff replacement. Okay.
He's the only one alive.
Oh, okay.
His sister's a brother.
Okay.
That's a very difficult question with the legalities of that. And depending on what state you're in also.
Exactly.
With the living wills and trusts. When you go, you actually, when we did it a long time ago, you actually go to a set of lawyers. So if you're talking to lawyers, it's very complicated. It's not as simple. And so you have to weigh the benefits and options. Because with the living will, the way they described it to me back then, and it may have changed because it's been so many years, Basically, it's like having a checking account. If I'm on your checking account, I can write a check today. I don't have to wait till I'm dead and gone. The idea is that you don't go to court, so when the person passes away, you already have signature rights to do whatever you need to do.
That's true.
Right?
Yeah.
But you have to be concerned about who you're giving this right to, right? So at that time, it was like, I said, well, I want my children, I'm doing all this for my children so that they won't have to go to court with the will
Right.
and have all those things. So he says to me, he says, but you know that they can sign, they can write this check today while you're still here. So you have to, I mean, that was a generality, but all of those things, you weigh, you know, what the benefit is and what you want to do and decide with that.
Definitely.
I was,
Especially different states, like he says, different states, but in today's, the reason I mentioned all those different ones.
Attorney though?
A power of attorney depends what you want to do. What I'm saying is, because we have things like those internet places where you can actually go and get some legal document done, that's how you come up with a lot of different things and conflicts. So what I'm saying is, just like he said, you need to know what is your agenda, what is your bottom line, what you want to do, and then when you go get representation, you tell them what you're looking to do or what you don't want done, and then based on what your desire is, your wishes are, they will give you the expert advice to make sure it goes that way.
Well, I don't understand, like in the, okay, I got power of attorney of the medical part of it.
Right.
But do I need power of attorney on everything else? Or
Well, that's what I'm saying. That's why you need to go and get you need to find out what is it you want to do. If you have the right to save medically and you're writing checks now, that's okay, that's what you want. But if you want to say, what about if in the interim between him and me, I get sick and now my children, who's going to do that? Will my children do it? Will somebody supersede my children? So all of these things are things you need to, write down what you want. And then, as I said, when you decide what you want and you get legal advice, they build it according to what you say. Some things you may need, some things you won't need, but the expert is going to tell you the right way to do it.
oh, okay.
That's awesome.
Then you can come back to me after her.
I recently did legal Zoom, like you're talking about, which is
Right.
you pay a lawyer, but you get to talk to him, you tell him what you want. And the power of attorney in my living trust, the terminology is, it's called a living trust because as long as I'm alive, I get to change it any way I want, and everything I have is mine until I'm either dead or
Incapacitated.
incapacitated, and a doctor has to say that I am not mentally fit in order for the financial power of attorney to kick in. So I don't know what the story is.
Yeah, well, that's what I was
but-
wondering.
But you should just go get your own, like she said, she did legal Zoom, get your own based on your family and what's going on. Because, that's a very personal thing and, especially if you have children, whatever it might be. But my thing is, you should have something, especially if you're already in the caregiving thing and you see things can go left or right, you need to make sure you're ready on paper. Okay? Did you say that somewhere?
Yes, I have
Okay.
a question, but one more comment after you just made that.
Oh, okay.
And when we were talking about that, one of the things that, again, being a caregiver, is said a lot of times that you might go before the other person.
Right.
So you're making all the preparations for them, but you haven't thought about yourself. So the ones that I had, both of us was in there. We had the same, go for the fact, including the power of attorney and what do they call it when you make a decision in the hospital when you
Advanced directive.
advance directive. That was really important. And then the main thing they said is you can't keep it a secret. You gotta have it so
That's what I
somebody
said.
have access to it
It's a nice to
when
tell.
the time comes for it. So the problem was that, did you tell your children that they're on this
That's
so they know where to go with this?
fine.
So again, being a caregiver, you're thinking, what are we thinking about?
Yeah, person.
My father had had a heart attack and lasted 25, my mother never had one, but she went first. So yes, we're thinking, because we're caregivers, but you need to take care of you and make sure that your portion is taken care of. And it's the same thing I said to my wife. I said, well, who can help me take care of these kids? if I happen to live, so it needs to go both ways. And it's real important that you get what you want.
Yeah, so, and that's what you want to do. You want to make sure
I
that
just
they
know when I
address
went
you.
to the VA, the social worker talked to me and she said, you need to have power of attorney.
Right, but she was talking about all that limited
Medical.
scope.
And
Right.
sure enough, I went to her, and his primary doctor told him, you give her power of attorney.
Okay.
And so he said, okay. And so meantime, we went to the caseworker, social worker, and she did it on her computer right there.
Right, that's part of their scope of, they can do that. But I'm just saying, when it comes further things that involve more family members, that's something different, so you need to make a plan about that.
Well, I just wanted to go back to, because understand, I always thought it was a really nice benefit, and maybe I'm talking about the home care again.
Oh, okay.
My ex used to do home care, hospice, and she used to tell me about that, and I thought it was such a great benefit that a lot of people did not know that they have typically, and maybe is. So your discussion was about, you emphasized Medicare, and maybe I'm thinking about our regular insurance. But in the past, it would seem to me as a caregiver, because that was the point she was making, that caregivers, they just really ignore themselves. They're so engrossed in taking care of their patient that they look up one day and they're just falling. Okay, they're so down and it's so hard to get back up. And she was saying people do not know, and especially she was talking about, at that time she was doing diabetes. And diabetes patients typically, she would say, just would ignore the symptoms, and she would tell them that I can show you how to cheat. And then they go and they get a leg amputated and another one, and then they're gone. And she said, it got to be such a thing that she had to get out of it. But in the process of that, in the past, when you had home care, they recognized that the caregiver, and it was so important to them that they did plan on giving that caregiver a lot of services. Maybe like once a week, they have someone come in and do the dishes, wash your laundry and things, let you go to a movie or something in the station. Of course, it was by the doctor, but as she mentioned, 72 hours. But at that time, when you left the hospital, you had a social worker or caseworker. That started when you got home, it was there.
Right.
I don't know if they're still doing it or it's Medicare is a little bit different. But all of that was taken care of. And that was one of the advantages of having the home care. She would come to the house. They would actually go early if you needed like special stairs or hand railings and all of these things. It was just really such a good service. If you needed I'm calling Pampers. All of those things was provided because it was cheaper than being in the hospital.
Definitely.
Right? So I don't know if they still do.
It's cheaper to come in, somebody to come in.
Oh, way.
Yeah, it is.
Because that's
Yeah,
what
well,
my
that's the way the
sister-
insurance company is looking at it.
Oh.
They're looking at their bottom, that's how they operate. I write on the bottom line. What does it cost for you to be cared for in the hospital versus skilled nursing versus at home? So it's always the bottom line or wherever they send you or don't send you.
But that's what my sister's considering now. Maybe just bring him back in, but just have somebody coming in now.
Right, but here's the deal, make sure it's, if you're thinking about how many hours they would be approved for, that's a lot of hours, so you need to, that's why you need to ask all these questions, because people, and I've had this happen, sometimes people just want their people home, they just want their loved one home, they just, well, I want home, okay, but when they get home, they don't have the bed together, they don't have the caregiver, they don't know the caregiver is not 24/7, you have to have multiple caregivers to pull that off. And then weekends, some people don't want to work weekends, and then you can get a bathing nurse, but man, that might be only a bath once a week, so now you need somebody to help lift and do it. So it's a lot of things into it, and if you don't get, like I told you, that whole discharge thing, if you don't get those questions answered on the spot from the case manager, from the social worker, of not what you could do, but what are you approved for? See, you could get anything, but what are you approved for? Regardless of your insurance, what will they approve for you, for your spouse, or be it household, whatever it may be?
Well, she's saying it's so expensive.
It's very
Put
expensive.
them out there, but people are talking to her and telling her maybe she should get a reverse mortgage on her house.
See, okay, well, I'm just saying, but a lot of things come into play. That's why you have to ask questions and ask questions. And don't just be settled for just one answer. Ask it again until you really are comfortable with it, and check and double check on it, because like I said, it's not just their life, it's your life. And you go from good health to poor health.
Right.
5 years, that's a long time. It's like
She already
5
got
months.
gone now.
Okay, so that's what goes on with the stress and everything else of it. So that's why, we're talking about caregivers being like the lifeline, the heart and lifeline of the family. But you have to realize that if you don't care for yourself, then the family doesn't have the lifeline anymore. So we always think that we're really showing how much we love them if we just work, but they need us, so we have to bring it in. Yeah.
That's pretty serious that they're talking about what's called a reverse mortgage. We shouldn't have to go through.
But what are they saying, that this is maybe cheaper for her than, because if you go out there, it's so expensive for.
Yeah, that's.
If you put in a facility, it's gonna be real expensive for them.
I totally agree with her. They're just looking at the bottom line. There is so many services and things that we don't know about.
Right.
Of course, it's not 100%. But any time that you go to your home, it's the same thing as a caregiver. You cannot take care of a person if you don't have a proper home.
Right.
So that means if you gave all this money away or for the care and things, you can't take care of yourself, food, travel, or whatever it is. It's a long-term deal. It's not a short-term. Right? And when they're gone, so now the house is gone, who can get the reverse mortgage? Now you have to pay for what you put in. No, I'm paying for insurance. Tell me how I can work this, give them the best care. And then it's a jungle, as far as I can tell. Oh, I can't imagine.
Any other questions?
Okay, I think is that all for everyone? I certainly hope that you've got some